This is a 73-year-old female who underwent a lung transplant and has been immobilized for 3 weeks due to multiple complications, including sepsis, multi-organ failure, and critical illness polyneuropathy. Taking a look at her lower extremity strength, you can see that her anterior tibs are just a trace of movement. Okay, we're assessing the ability for her to bend her knees, kind of like a heel slide movement. And you can see there's no movement, and also for the other side. Okay, here I'm going to come up and look at her quad strength, putting her in a short arc quad position, trying to raise her foot up off the bed. And you can see just a trace, just a very poor strength of her quads there. It's going to be the same with the left leg as well. Can barely get her heel up off the bed. This clip shows an OT-PT co-treatment where we're assessing her ability to sit upright. You can see it's kind of bringing her to the edge of the bed and trying to sit up. And you can see that she is dependent to sit up and displays very poor trunk control, requiring maximal assistance to sit up. Okay, upright standing at this point would be inappropriate because she doesn't have the ability to sit up without assistance. She is severely deconditioned. However, she is an excellent candidate for the Moveo because she's medically stable, she's able to follow simple commands, and she displays at least a trace of lower extremity extensor strength. This clip shows the transfer over to the carriage, monitoring the lines. There's the vent tubing, chest tube tubing. We'll bring her halfway first, then all the way onto the carriage. It usually takes 2 for the transfer with a draw sheet, and you want to make sure the draw sheet extends from the buttocks all the way to the shoulders. If it's below the shoulders, the patient's skin will contact the fabric and make it more difficult to slide. So this is a patient who only displayed trace to poor knee extensor strength, but at approximately 50% of her body weight, she can perform controlled and independent squats, and this is really something that none of us really expected. I mean, maybe 10 to 15% of her body weight, but you can see how she slowly comes down and then pushes herself back up at that 50% of body weight. We believe that this weight-bearing position allows for patients to use their muscles more effectively compared to in-bed open chain exercises because it simulates a functional activity. Typical exercises such as heel slides, short arc quads, straight leg raises do not simulate functional activities.